Maria was a vibrant young woman, a graphic designer who loved hiking on weekends and spending evenings with her close circle of friends. She felt perfectly healthy, full of energy and plans for the future. One day, her doctor suggested a routine HIV test during her annual checkup. Maria hesitated, thinking it wasn't for her. She was in a long-term relationship and felt safe. But her doctor explained it was a standard part of modern healthcare, a simple step to know more about her own body. A week later, a phone call changed everything. The clinic asked her to come in to discuss her results, and the news was something she never expected. Her test was positive. The world seemed to stop for a moment, and a wave of fear washed over her. The initial shock was immense, bringing with it a flood of questions and anxieties. Maria thought about her partner, her family, and her dreams. How could this have happened? What did this mean for her life? The diagnosis felt like a heavy weight, a label she didn't know how to carry. However, in that small clinic room, Maria also found a lifeline. A kind and patient healthcare counselor sat with her, explaining that an HIV diagnosis today is not a death sentence. The counselor spoke about modern treatments, powerful medications that could help her live a long, healthy, and fulfilling life. This crucial piece of information was like the first ray of sunshine breaking through a dark storm cloud. Maria's journey started that day, not as a victim, but as a proactive manager of her own health. She learned that knowledge was her greatest tool. She started treatment, joined a support group, and found strength in a community of people who understood her experience. Her story is a powerful reminder for all of us. It shows that HIV can affect anyone, regardless of age, gender, or lifestyle. More importantly, it highlights that knowing your status is the first most critical step toward a future defined not by a virus but by resilience, health, and hope. To understand the importance of testing, we must first understand what HIV is. HIV stands for Human Immunodeficiency Virus. Think of your body as a country and your immune system as its army. This army is made up of special soldier cells called CD4 cells or T cells that fight off germs like bacteria and viruses to keep you healthy. HIV is a very specific kind of virus that attacks these soldier cells. It gets inside the CD4 cells and uses them to make more copies of itself. HIV is different from other viruses like the ones that cause the common cold or the flu. Your immune system can typically clear most viruses out of your body over time. This is not the case with HIV. Once a person has HIV, they have it for life. The human body cannot get rid of the virus on its own. However, this is where modern medicine has made incredible strides. We now have very effective medications that can stop the virus from making copies of itself. It is also important to know how HIV is transmitted, and just as importantly, how it is not. HIV is found in certain body fluids, such as blood, semen, rectal fluids, vaginal fluids, and breast milk. The virus can be passed from one person to another through specific activities, most commonly through unprotected sexual contact, or by sharing needles or syringes used for injecting drugs. You cannot get HIV from hugging, shaking hands, sharing toilets, or from insect bites like mosquitoes. Understanding these facts helps to reduce fear and stigma. Without treatment, HIV will continue to damage the immune system, leading to a more advanced stage of the infection called AIDS, which stands for Acquired Immunodeficiency Syndrome. However, thanks to effective treatment, most people with HIV in the United States and other parts of the world today do not develop AIDS. With consistent care, they can maintain a strong immune system and live long, healthy lives, underscoring the vital importance of getting tested and starting treatment early.